It's your turn to help them now. We're here to show you how.
Let's talk about advance directives. None of us have a choice about whether we're going to die or when we're going to die. But with proper planning, we can make some choices about the manner in which we pass away. The purpose of an advance directive is allow you to make choices about medical procedures which will be done to you or which you would not like to have done to you. Things like breathing machines, feeding tubes, electrical shocks, things like that. And I've yet to meet a patient who says, I want to live forever like a vegetable hooked up to machines. Now that is a choice somebody may make, but the advance directive allows the patient to make specific decisions with nuanced choices in advance so that you don't have to do it at the bedside at the last minute. Advance directives come in many forms. There are the living wills that are typically done with attorneys, and there are also forms which in different states are called either POLSTs or MOLSTs. The MOLST and the POLST is an acronym that stands for Medical Orders for Life-Sustaining Treatment or Physician Orders for Life-Sustaining Treatment. The difference between a MOLST and a living will is the language in which they're written and also the specifics. The living will is written by an attorney, and it is fairly general, and it is written by and with somebody who doesn't know anything about medical procedures. It is designed to be legally binding, and it is designed to protect you legally. Unfortunately, the language in a living will is often incomprehensible to a physician at the bedside, or is so general that it doesn't really mean much. A MOLST or a POLST has specific information written in medical language so that the patient has an opportunity to choose things that they want done and things that they do not want done to them in an effort to extend their lives. A lot of people feel that the MOLST or POLST should be done when the end of life is near. Others feel that it should be done far in advance of this time when you're healthy, and so that you're able to objectively and non-emotionally make choices. Plus, the MOLST or the POLST is a living document, meaning as your life circumstances change, you can change the particulars. If, for example, you are a 50-year-old vigorous adult and you like to ride motorcycles and you know that there's a certain risk involved, you may decide, I may have an accident, but I still have a lot of life ahead of me, so I want all kinds of medical procedures done to try and extend my life as long as possible. You may, when you're 75 years old, decide, I've had a long, wonderful life. At this point, I'm frail, and I don't see that there's any point in trying to extend my life and potentially increase the indignity and the debt and the pain in a futile attempt to extend my life. In that case, you would change the MOLST or the POLST and say you can do certain things to me, but don't do them if I'm not going to return to a quality of life. These are things that I think it's important to discuss with your family in advance. The other reason you want to have a discussion with your family or family members, it's important for you to have the discussion with your parents, is because the decision does not get easier when you're at the bedside and they're actively dying and you haven't had the discussion before. Parents, if you don't tell your kids what you want, then they have to live with the burden of never knowing if they made the right decision on your behalf. Reverse parenters, you need to think back and you need to think about what were the types of decisions that were made by your parents about quality of life and big decisions. You are, after all, when you're acting as their agent, not making choices that you want. It's your responsibility to make choices that they would make. And that can be very, very difficult. So plan in advance. In the same way that you put your seatbelt on in your car far in advance of being in an accident, you need to fill out this living will or advance directive or MOLST far in advance of passing away. The MOLST or the POLST is typically a pink piece of paper. The reason it's pink is not for any legal reasons. It's pink so that it is easily found. Typically, people put it on their refrigerator so that if you have to call 911, the EMS comes and they look for it and they see it there so they can ask for it. It is also there in pink so that you can find it in stacks of other paper. That Molster post belongs to the patient. You should bring it with you to every doctor's visit, and you should bring it with you when you go to the hospital. Reverse parenters, you should always know where it is, and I recommend that you take photographs of it so it is always on your phone. When you bring it to the doctor or the hospital, they may ask to take it, or they may ask that you do another one. You are not required to fill out another one, and they really are not correct to take it from you. It is your document. They're correct to review it with you, and they should sign it to indicate that they have reviewed it, and then it is up to them to copy it and to keep a copy. And then if you choose to update it, you can update it at any time. But my recommendation is that you don't let them take it. You hold on to it yourself and you keep copies yourself. There's no legal significance to the pink color of the form. You can copy it onto white paper. It doesn't matter. In fact, the form itself is not a legal document unless you sign it and treat it as such. You can write one out on your own on plain paper, and it has the same legal weight as the pink form. But obviously, if you use the pink form that has already been looked at and by medical professionals, it's going to be specific and it'll be uniform. So that's the one that I recommend. The first page of the MOLST form usually discusses cardiopulmonary resuscitation or CPR. And the second page usually discusses things like intubation or putting a tube in your throat for breathing and connecting it to a ventilator. It also usually discusses things like feeding tubes and antibiotics and fluids and whether you want to be brought to the hospital in the event of an emergency. These are sometimes referred to as resuscitation efforts, and some people refer to the entire document as a DNR, which stands for Do Not Resuscitate. I discourage people from using the expression DNR because resuscitation is very general, and it really does not tell people what you want, because you may want some measures that will resuscitate you and not other ones that will resuscitate you. So Do Not Resuscitate is far too general.
It's your turn to help them now. We're here to show you how.